Hello there, this is Abena and welcome to my channel. I'm going to talk about my journey to recovery living with degenerative vertebra for many years, how it all started and why I ended up considering spinal fusion surgery. So I got injured as working as home health aide in the Boston area. I was repositioning a client in bed, and all of a sudden, I felt something going through my body like an electric shock. I couldn't move, I was screaming, the pain was excruciating. And then the client's husband had to call 911. The crew, um, the crew came in and they helped me and transported me to the hospital. When I got there, X-ray was done. They couldn't see anything. I was given some medications, pain medications, and I was discharged. And I had this paperwork, and I had to just follow up with my primary physician. I called them and I got a next day appointment. So I went to the urgent care, and I was referred to an ortho specialist. When I got there, because they couldn't find anything in the X-ray, he recommended MRI. So when the results came, the doctor told me that I have herniated disc and something that he believed will heal by itself um, over time. He told me that I didn't need surgery that moment, and he believed that I would get better over the years. And I was happy about it. I'm like, okay, now I don't need surgery. Yay. So what next? So there were treatment available to me. He didn't want us to start with the most invasive treatment. He wanted us to start with the last one and see how it goes. So he recommended physical therapy, and then he gave me few medications to manage my pain at home. I went to the PT for some months. It wasn't helping. I ended up staying home for 2 years because I was having mobility issues. I couldn't go do my routines like I used to. And when you look at me, I look like a C. I was stepping to my left side and was kind of putting more pressure on my left because the injury was on my right side. So physical therapy wasn't helping, so we had to move to the next option, and it was the cortisone shots, and that I have to take every 6 months. The first one, oh my goodness, I mean, the first time I had a cortisone shot, it went well. I was pain free. Oh my goodness, it was a great feeling. The second time I had it, oh my goodness, it was amazing. I remember I went to Ghana for my mom's funeral, and when you look at me, you don't even see that I have any injury. Everything was fine. So I was gonna go for the third one, and then my ortho specialist said, "Girl, we need to have a talk." He was a bit concerned about my health because he was like, "You are too young," and he was scared that giving me cortisone shot every 6 months is gonna affect my spine. So he encouraged me to use pain medications and the PT to see if how things go. So I listened to him, and then I started the PT, but for some reason, I don't know whether the cortisone shot was so powerful, but after 6 months, I was still feeling great. I was doing my thing. I was having a little bit of pain, but not so much that I didn't have to work or anything. So, I got pregnant along the way, and then I got bigger, and then I had a baby. I had to carry car seat around, and I live on the third floor and everything, and it kind of put strain on my back. So after COVID, that was 2020, I had to go back to work, and all of a sudden, uh, there was this pain that I couldn't explain. It wasn't even like before when I had the injury. This pain was so agonizing, and it was kind of going through both legs. Oh my goodness, I don't know how to describe it. It was painful. I couldn't stand for a minute. I couldn't walk for more than a minute. It was impacting my job. It was impacting my daily life, my relating to others, going to functions. Like, it was so painful that every time I wake up, all I'm thinking about is this pain. Because sometimes I even have a hard time getting out of bed, and even sometimes I have to. I can't even walk to the bathroom. Sometimes I try to get out of bed and I have to go back to bed to reset before I can able to move. The pain was so bad that it was affecting basically everything. So I had to talk to my other doctor, and this time I don't know what happened to my old one, so I got a new one, and he requested MRI because like he was like, girl, you have not had an MRI done in many years, so who knows what is happening to your back, so let's check it out. So I had an MRI, and guess what? He said that I have degenerative vertebra, and it affected L4 and L5. And he showed me the images, and he told me that they are kind of pressing on the nerves and causing all this pain. So he referred me to a neurosurgeon, and then he recommended surgery since PT wasn't working. Oh, I missed out one thing. After that, after the MRI, the second one, um, I had 2 cortisone shots. We didn't do anything. Oh my goodness, I had 2 shots, and the pain was the same. It didn't help one bit, and that is when he referred me to the neurosurgeon. So he recommended surgery, and he demonstrated it to me how things will be done and everything. And I got scared because I'm like, spinal cord is something that you don't have to joke it. What if I ended up in the wheelchair? So I told him that this is too much for me to deal with, so I needed time to, think about it. So he gave me the time, and girl, I was so scared. I'm like, no way. So I came home, and I read all the bad things that can go wrong. What I'm gonna tell you is, whenever you see a specialist or a doctor and they recommend surgery, you need to do your research. Usually what I do is I ask for second opinion, so they'll refer you to another specialist or something. But when you go to YouTube and I would say social media, the things that you find there, sometimes it will discourage you from going ahead. But you never know. I'm gonna tell you, like, every story is different. So whenever you are scared of something, I know sometimes getting information or hearing from other people in the same situation is helpful, but sometimes not. Getting the right information can also impact your decision on these issues. So I got scared, and I'm like, I'm not doing it, because what if it fails? What if I had to be in the wheelchair? So I had to live in pain for another year. Oh my goodness. I don't even know how I was doing it. It was so painful. And then I called the doctor a year later. I'm like, I changed my mind. And he's like, if you change your mind since your MRI is more than 6 months, you need to get another one done. So when I got the second one with the neurosurgeon, it was bad. It was getting worse. It was terrible. So this time I had to decide. I'm like, if I like it or not, I'm gonna end up in a wheelchair one way or the other. So it's either I have the surgery and end up in wheelchair, or I just leave. I just decline the surgery and end up in the wheelchair. And it was a tough decision. Wait for part 2. Bye.